Start the recording here. Okay, so again, this is Ed Crow. Today we're going to talk about a sales strategy using Advantage plans and supplements, explaining the two types of products to your client or prospect and showing them, helping them determine which kind of plan they want. This has been advantageous I used this myself for years, and it's been advantageous for other agents and agencies for multiple reasons, which we'll go over. So what we'll do today is talk about Original Medicare and Irma, which you have to know. It sounds obvious, but oftentimes we get brokers that really aren't all that familiar with Original Medicare benefits or Irma, and that's definitely two things you need to know well if you're going to use this strategy. Then we'll talk about supplements, go over the positives and negatives, and how you would explain them to your client as well. Talk about Advantage plans, same thing, pros and cons of Advantage plans, and then we'll just talk about choosing a plan type at the end. This webinar should only take about 20 minutes. I don't anticipate it taking much longer than that. We'll get started. Okay, quick before we get started, most of you on this call are probably familiar, but we do offer Crow & Associates, so we're out of an FMO out of Brookfield. We do offer a free Medicare lead program. If you want information on that, feel free to email me email me or call our office and we can give you information on that. There's no reduction in commission. We pay up to $500 a month towards your leads, marketing, or advertising expense for Medicare. I didn't put anything about it in the slides. I just wanted to mention it because oftentimes we get people that work with us that don't realize it's available. So it is. You can use any lead company you want, and as long as it's for Medicare, we will reimburse you for your costs for Medicare. So you can get details about that from us. Just email us, and we'll be happy to email you information about it. But for today, we're going to talk about a strategy of selling using Advantage plans versus supplements. And again, in general, what you're doing here is it's just a way to talk to your clients and prospects about the difference between the two types of plans in an easily understandable manner so they can understand it, and it helps them then to determine which type of plan they want. Couple quick cliff notes here. If you meet with somebody who says, I don't care about Advantage plans, I dislike them, I want a supplement, my suggestion is put them in a supplement. Don't force this. Most of the time you meet with people, they will want to know the difference, but if they don't, if they're dead set on what they want, give them what they want. In my younger years, I used to still explain it to them and try to maybe convince them one way or the other, and I find that's definitely swimming upstream doing it that way. So, if they come in and they show you what they say, this is what I want, well, then you just kind of ditch the whole comparison and just go with what they want. Otherwise, this is a good way to roll it out to them. This strategy is used over the phone and in person, so it works both ways. You can use it on Zoom meetings. You can use it in person. You can use it with a screen share. It makes it easy. So to get started, first thing is, you really, as the agent, you need to understand Medicare and B benefits in order to make good recommendations about if they should have a supplement or a Medicare Advantage plan and which might fit them better. So you definitely have to understand the A and B cost share basics. If you don't, and oftentimes we get brokers that sell that really don't, it makes it hard to recommend a certain supplement or an Advantage plan if you don't understand what A and B is covering in the first place. Obviously, go over them. So what you would do is you'd go over Medicare and B benefits and cost share with them, just basics. Now you don't get crazy about it. Talk to them about Medicare approved services and allowable amounts. In other words, I tend to say a Plan G supplement covers everything but a $198 deductible. Well, it's not really accurate. You should say it covers all Medicare approved medical services after you pay the $198 deductible, because sometimes people will catch you on that if they'll go get a service that Medicare doesn't approve, and then the supplement won't cover it either, obviously. So, you got to make that clear to them. And we also talked to them about Medicare allowable amounts. The fact that, a doctor might bill $180 to Medicare for a doctor's visit, but Medicare for a primary only allows about $85. So, that conversation's important. Want to talk to them about par doctors versus non-par and opt-outs. So, especially when we're talking about Original Medicare and supplements for that matter, it's important to explain the majority of doctors are par with Medicare. You have some that participate with Medicare but are non-par, and then you have some that are completely opted out. And obviously, if they're opted out of Medicare, they're not going to be in network on an Advantage plan. There's certainly, a supplement is not going to help with an opt-out. So you just got to make them aware of that. One note I wanted to make is people worry a lot about with supplements G and N about excess, because obviously G covers excess, Part B excess, N doesn't. Keep in mind, though, the only doctors that can charge Part B excess are non-par doctors. So that's a doctor that's participating in Medicare but isn't accepting assignment. It's a very small amount of the population. They are the only ones that can charge the excess, and excess is 15% of the Medicare 15% above the Medicare allowable amount. So it's not 15% above what they charge. It's 15% above what Medicare allows. So it really doesn't come into play as a huge factor that often, except for when it does. Once in a while, when you get somebody who's seeing a non-par doctor, they're getting billed the excess. But again, it won't add up to a lot of money. Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont don't allow excess charges at all. So even if they go to a non-par doctor in those states, that non-par doctor isn't allowed to bill excess. So if they're in a plan N, they're fine, even though N doesn't cover excess. New York is the one exception now in that list. They made a recent change where doctors are now in New York, which was formerly a state that didn't allow any excess at all. They are now allowed in New York to charge 5% excess if they're non-par. All right, so we'll go over the original cost share of Medicare in 2020. Obviously, this is going to change for 2021, but right now, as it stands, the Part B premium, the standard Part B premium is $144.60. You got to make people aware of that. A lot of times, I assume they know, they don't usually. So you make them aware of the fact that they're going to pay $144.60 when they enroll in Part B, unless they make higher incomes and they have an Irma penalty. You let them know how it's going to be billed. If they're drawing Social Security, it's going to be sucked right out of their Social Security check every month. If they're not drawing Social Security, the $144.60 is going to be billed quarterly to them. So they might get a bill for whatever that is, $40 something, and say, well, you said it'd be $144. Well, that's a quarterly bill, and they won't realize that often. But you got to make them aware of it, and don't let that be a surprise to them about how much Part B costs. If they've gone down to Social Security or talked to Social Security, a lot of times they don't even mention that, or at least they don't remember it. The Part B deductible for 2020 is $198, so that's important to know. When it comes to Irma, it's for Part B and D. Even I forget sometimes that Irma affects Part D as well. So they pay additional money for Part B, and they have an Irma penalty tacked onto Part D as well. The income brackets for Irma have been adjusted for 2020. I'm going to show those to you in a few minutes. And keep in mind, when they're looking at Irma, they look 2 years back. Now, obviously, if you're meeting with a client and you know they have a lower amount of income, you don't even really have to have the Irma conversation. But obviously, if you have a client or husband and wife, for example, that are making, substantial income, you'll want to have that Irma conversation with them initially. So for starters, you want to talk to them about A and B, cost share, Part B premium, the Part B deductible. A deductible as well, of course, but you want to talk to them about Irma if there are higher income earners. And when they look at Irma, keep in mind it's 2 years back, so your 2020 Irma is going to be based on what you made in 2018. Clients can appeal Irma, so under certain situations, so if you get somebody who made $400,000 a year, but then they retired in 2020 and they're going on Part B and you're putting them in a plan, they're going to have an Irma penalty, even though their income, maybe it's going down to hardly anything for 2020. It's a 2-year look back. They can appeal that. They can talk to Social Security, let them know their situation has changed due to retirement, and that their income, even though they were, have an Irma penalty based on what they made in 2018, in 2020, their income is going to be much lower, and they can appeal that and get that changed. And obviously, that'll make them happy and save them a fair amount of money. So here's the Irma Grid. This is for Part B of Medicare. As you can see, based on 2020, applicable to people and what they'll pay in based on 2018. but this determines what they'll pay in 2020. So for individuals, if they're making $80,000 or less, $87,000 or less, they're going to pay the standard $144.60. For somebody married filing joint, it's $174 or less. And you can see it goes up from there, and it's bracketed. So you got your standard $144.60, but if they're making an individual is making between $87,000 and $109,000, you can see it's going to go up to $202.40, and it tops out at $491 for individuals making $500 or more, or couples making $750 or more back in 2018. So that's what they're going to tack on to their Part B premium, and that's what they'll pay monthly due to the Irma penalty. As I mentioned earlier, Irma also applies to Part D. I forget to mention that myself often, but it does, and it uses the same brackets. And as you can see, if they're making 87 or less as an individual, or a couple's making less than 174, they just have their standard Part D premium for whatever plan they choose, or if they're in an Advantage plan, nothing. If they're above the limits, then they're going to have additional money tacked on to their Part D. And the way they'll do that is, if you enroll them in a standalone Part D plan, they'll have their premium plus the Irma amount listed here. If they're in an Advantage plan, you got to be careful there. You might say to them, well, you're in a zero premium plan. It's going to be billed through the Advantage plan. So suddenly you told them they'd have no premium. They're paying $1,220 a month. That's because of the Part D Irma. So you got to make them aware of that, and the fact that it'll be billed through the plan, whether it's a standalone Part D or an Advantage plan. So, as I said on here, not that you necessarily care, but sometimes people will ask you, what does IRMA stand for? Well, it's Income-Related Monthly Adjustment Amount. So it's a nice way of saying you made too much and we're going to penalize you for it. As I mentioned, the Part D IRMA is billed through the drug plan, whether it's through a standalone or an Advantage plan. The Part B IRMA is taken out of the Social Security check. If they're not drawing Social Security, it's added to their quarterly bill. And again, if they're on an Advantage plan, it's going to be added to their Advantage premium. So suddenly, not the Part B won't, but the Part D will. Part B, again, is taken through Social Security or billed to them. But the Part D IRMA will be added to an Advantage plan, so a zero premium plan suddenly is not a zero premium plan. So usually what we do is we'll have that conversation with them. We feel it out depending on their situation, but talk to them about A benefits, B benefits, talk to them about Part B premium IRMA. And then once we've explained A and B, we say to them, okay, the idea here then is how are we going to cover the things that original Medicare doesn't cover on the medical, and how are we going to get you drug coverage? And there's two traditional ways people go about this. And it's usually easier to transition into supplements first and talk about them, and then we'll talk about Advantage next. Now, again, if your client says or prospect says, I hate Advantage plans, I want a supplement, or I don't want a network, or they say, I want a zero premium plan, just go with it. Ditch the presentation and put them in what they want. Otherwise, this is the progression you would go through. So explain to them on a supplement, Medicare's primary. So there is no network with a supplement. It doesn't matter what company you use. Medicare is being billed. All that doctor cares about is if they participate with Medicare, they bill Medicare. They don't care who the supplement company is. It could be a Crow's supplement, and it wouldn't make a difference. So there's no network with a supplement. And carriers, it doesn't matter what carrier you use as long as they take original Medicare. As I mentioned earlier, you got to try not to forget to mention to them that Medicare supplements only cover Medicare-approved services. So if Medicare doesn't approve it, the supplement's not going to help either. Supplements have no medical management. So unlike an Advantage plan where they might have to get prior authorization for an MRI, you don't have to do that with original Medicare and a sup. Supplements, and you want to mention this to them, supplements are standardized. So benefits are identical from carrier to carrier. So if there's 8 companies offering a Plan G, their benefits are identical. Their main benefits are identical from plan to plan. It does not make a difference. It is simply a pricing contest to see who offers the best price. Claims adjudication, all those things, it matters not with the supplement network. It's all equal. It's simply pricing. The only one exception to that would be sometimes, as you know, a supplement might offer a gym membership like Silver Sneakers or Silver and Fit, or or United's program. They might have some kind of gym membership. Some supplements may have it, some may not. And again, all providers in Medicare are covered by supplements. There is no network to worry about. So then we'll talk to them about the positives. So no network. That would include, meaning with a supplement you have access to multiple states and specialty hospitals. So no matter what state you're in, your supplement will work. In every specialty hospital in the country other than children's hospitals accept original Medicare still. So it gets you access to those places. Hospital for Special Surgery is an example of that. There's no managed care on a supplement. So when we're going through supplements with people, we're saying these are the positives. There's no managed care. Benefits are standardized, as I mentioned before. You can use a supplement to determine your exact amount of coverage. So unlike an Advantage plan where it's kind of up in the air, depending on how much you utilize, we know what we're giving them with the supplement. Plan G, they're going to pay $198, and that's it. They're done. Plan N, they're going to pay $198 plus 20, up to 20 for a doctor's visit, 50 for the ER, and they're done. Another positive with supplements is you can customize the drug plan. So you can run their drugs, like we use Connect for Medicare, for example, to run drugs and save the drug list. You can run it through Connect for Medicare or through the CMS site, and you can pick specifically the drug plan that fits best for them, that's going to have the lowest out-of-pocket cost for them for the year. On the negative side, pretty straightforward here. You pay 3 premiums. You got your Part B premium, the premium for the supplement, and the Part D premium. Preventative coverage with a supplement lately, last couple of years, can be an issue. You get more and more now. Doctors will have somebody in for a physical, and they'll bill services that Medicare doesn't approve as preventative, and then your client will get a bill. So it helps if they have a conversation with their doctor saying, if you're going to do a physical on me, I only want services approved by Medicare for preventative. If you're going to do something other than that, talk to me about it first. A lot of times they'll just do it and bill them after the fact. And obviously a negative on a supplement is you got to pay for a separate standalone drug plan. So we'll lay that out for them and say, if you're going to go the supplement route, here's the pros, here's the cons of doing that. Then usually we summarize by saying overall. So overall, supplements are a good choice for the following people. High utilizers of medical care, so people going to the doctor or the hospital a lot. People with doctors in multiple states, because with the supplement you don't have to worry about matching the network up. People who have to use a specialty hospital, because a lot of specialty hospitals don't participate with Advantage plans. And people that don't like managed care or networks. Sometimes you'll get somebody who just says, I don't want anybody telling me where I can go or can't go. It's probably a supplement candidate. They're dead set against networks because, as you know, with an Advantage plan, even if it's a PPO, if they go out of network on that PPO, one of two things is going to happen. Either the doctor is going to say, I know your plan has out of network, but I don't care. I'm not going to see you. Or if they do see them, they're going to have a lot more out of pocket when they go out of network on a PPO plan. So we'll talk to them about supplements, go over the pros and cons, explain it to them. Usually ask them some questions to determine how much they're utilizing care to give us some perspective. And then we'll transition into Advantage plans and say, okay, the alternative to doing that are Medicare Advantage plans, and we'll go over the positives of them. Obviously, most of the popular plans are 0 monthly premium, so you're still going to pay your Part B premium of $144.60, but the Advantage plan, you're going to get medical benefits, and you're going to get the drug plan for no additional premium. And I'll also give them some perspective too. Like if they've been on a group health plan, I'll say your Advantage plan is going to look and feel and act a lot like a group health plan. And I also emphasize with them, when you take an Advantage plan, you are not using Medicare. You're not kicked out of the program, but you're not using Medicare. So the doctors, the hospitals, they are not going to be billing original Medicare. They're billing the Advantage plan. The Advantage plan is your primary coverage, not Medicare. So obviously positives are 0 monthly premium, full preventative coverage, physical, eye exams, and preventative measures are covered on the Advantage plan where there might be gaps on a supplement because sometimes the doctor will bill things that Medicare doesn't approve. Another positive is that your drug plan is included. I think there's a misconception. A lot of times people think the standalone drug plans are better than the drug plans included in the Advantage plans, and that's really not the case. It's like anything else. You just got to match up the drug plan in the Advantage. But I would say that in general, they're certainly as good as standalone PDPs. Advantage plans have vision, dental, hearing, OTC, gym memberships. A lot of times people, and myself included, I have trouble keeping straight which Advantage plan offers which vision benefit and who has the best dental and how much OTC. Use our quote site or Connect for Medicare for that. You can quote and compare those plans, and it'll compare them side by side, so you can just quickly look and see who has the best OTC benefit, what gym memberships, who has the best hearing and dental. It's a quick way to remind yourself. Other positives can be depending on your state. Some plans have Part B reimbursements up to $120 a month. You'll see that a lot in California and Florida especially. A few plans in New York as well. Well, they'll reimburse different amounts depending on the plan. Most of them don't go higher than $120 a month, but they'll reduce their Part B premium by that amount of money. But again, that's not in every state. For example, I'm in Connecticut. We don't have any Part B reimbursement plans here. Then we hit the negatives of the Advantage plan. So it has positives, it has negatives. Negatives are if you have a bad year, your copays can add up. I mean, CMS sets the out-of-pocket max at $6,700. So, and that's going up, by the way, for 2021. But right now, as it stands, you could hit your max out-of-pocket if you have a really bad year. God forbid you get cancer, you need just a tremendous amount of care. You could wind up paying $6,700 in copays. By the way, some states do it much lower, even though CMS sets the max amount of $6,700, and a lot of plans adopt that in certain states. They go right up to the $6,700. Some states are much lower. I mean, California and Los Angeles County, they have plans that are $990 OOPs. So they've got $990 out-of-pocket maxes. Almost makes you wonder why somebody would take a supplement in those states when you have an out-of-pocket max that is that low. A negative for Advantage can be network. Certainly, a lot of plans have big networks, but it's perceived as a negative by many because you can check doctors for them, but down the road, mid-year, they need to see a doctor that they're not aware of. Who knows if that doctor is going to be in network or not. Of course, there's PPO and POS plans. I never rely on that. If they say, well, don't worry, I don't have to check my doctors because this is a TPO or POS, you should still check them. If they go out of network, they're going to pay a lot more money. And some doctors may refuse to see them if it's out of network. Another negative is managed care. So Advantage plans are medically managed. That means they have prior authorization on services, which will slow down access to care. You need a CAT scan. The doctor or the facility has to get prior auth for you to get that, and it might delay that scan for you for a few days, whereas on original Medicare, you'd be able to get it right away. Managed care on Advantage plans can be a big negative on skilled nursing. The reason being is, obviously, the first 20 days are covered in full, but after 20 days, for those of you who have had people on Advantage plans who have received skilled nursing, after 20 days, they make it difficult for the people to stay in the skilled nursing facility. So they have coverage for 100 days, but after 20, they're going to get them out of there, or they're going to make it hard for them to stay. You don't get that as much on Medicare. They are starting to do that a little, but certainly it happens more on an Advantage plan. Just want to do something regarding hospital inpatient copay clarification. When you go in the hospital on a Medicare Advantage plan and you pay your hospital copay, there is no 60-day benefit period, meaning if you go in the hospital and pay your copay, say 5 days worth or whatever it may be, and then next week you come out and next week you go back in, you don't get a 60-day grace period like you do on original Medicare. You're going to pay that copay again on an Advantage plan. Versus original Medicare and a supplement, you go in the hospital, even if your supplement's paying the hospital cost share. If you go in the hospital, you go out, you go back in, you've got 60 days. So if you go back in within the next 60 days, there is no new deductible. So overall, Advantage plans are really good choices for people that don't utilize a lot of care. You'll oftentimes get somebody, this happens quite often, you get somebody who says, I go to the doctor 3 times a year, or I go once a year, or I never go. Probably a good person to talk to about a Medicare Advantage plan. Your copays can add up to the out-of-pocket max if you have a really bad year, but the copays are reasonable, and you need high volume to hit an out-of-pocket max. Some people will really gravitate towards the additional benefits on an Advantage plan. I guess some people who, the fact that it has dental and vision and OTC, that's more important to them than anything else. It doesn't logically make a lot of sense, but bells and whistles benefits to some people are really important. In fact, it seems like it's grown a lot in the last couple of years where people are really searching for dental. And they'll say, well, if that Advantage plan's got dental, I want that. And of course, overall, if they take an Advantage plan and they're not utilizing a lot of care, the savings versus a supplement and drug plan can be substantial. So we'll talk to them about supplements, positive and negatives, give them kind of the overall feel for who should be in a supplement, talk to them about Advantage, positives and negatives, and again, kind of give them an overall just summary like I did there about the difference between the two. Once we do that, we try to determine what they want. Now, at this point, usually they'll know, but if they don't, you can ask some questions to bring it out. How often do you tend to use healthcare? Do you go often? And clarify that, by the way. I have some people who say, I don't use much care at all. I only went to the hospital twice last year, and I visited the doctor 5 times a month. So clarify. Say, how often do you utilize health care? Do you currently have a plan with a network? If you're talking to a T65 or a delayed B enrollment for somebody who's working, they probably are in a network plan already, so they might be open to the idea of an Advantage plan. Where are your doctors located? So are all their doctors in one state? Makes it a lot easier to match them up with an Advantage plan versus are they in multiple states? We get that here a lot where people have doctors in Connecticut and New York. Might make it tough to match up the network on an Advantage plan, maybe a supplement then. And as I mentioned a couple times earlier, don't force it. If they are really set on the type of plan they want, you give it to them. It's ultimately up to them anyway. Really, as a broker, your job is just to explain the difference between the two plan types, positives and negatives of each, so they can make an educated decision on what fits their needs the most. When we're talking about somebody taking an Advantage plan, we got to have a conversation about guaranteed issue versus non-guaranteed issue states. That's important. New York, Connecticut, Massachusetts, and Maine are guaranteed issue at all times. It makes it a lot easier for somebody to take an Advantage plan then. Because they know they can take an Advantage plan, they can look at it year by year, and if their health takes a turn for the worse, they can switch, regardless of their health in those states, they can switch to a supplement every January through May. And I say January through May because you've got AEP, where you can make a change for January, and then you've got the OEP, where which is January, February, February, March, and April, where you can switch from Advantage to supplement. If they're in a guaranteed issue state, there's no risk that they won't be able to switch. So in a guaranteed issue state, it makes a lot of sense for people to start off with an Advantage plan, unless they're really just utilizing tons of care already when they go on Medicare. You got to put a little more thought into this in non-guaranteed issue states. Reason being is because in most states, after 1 year, non-guaranteed issue states, they have a bad turn in their health during AEP or OEP, they want to switch to a supplement. They're going to go through full underwriting. California and Oregon have a birthday rule, which is guaranteed issue. That's a 30-day period prior to their birthday where they're guaranteed to be able to switch. But most underwritten states, they can't. And it ranges or varies from state to state, but some states give you a year where you can switch without underwriting. Some states give you 2. But after those time periods end, that client wants to get out of their Advantage plan, they can't if their health is taking a turn for the worse. When you're having these conversations, remember trial rights. Trial rights are applicable regardless of the state, even if it's an underwritten state. And the 2 trial rights you have are if somebody takes an Advantage plan when they turn 65, they've got a 1-year trial right guaranteed issue. That means they take an Advantage plan maybe in February. Come July or August, they say, hey, this thing isn't for me. Well, a trial right means they've got a 12-month period where on a guaranteed issue basis, the first of any month, they can switch out of the Advantage plan and go to a supplement and drug plan without underwriting. And that trial right's only applicable to people that take an Advantage plan when they actually turn 65. The other trial right is for somebody who has had nothing but a supplement since they were eligible for Medicare. So eligible for Medicare, they've been on nothing but a supplement. And at some point they say, I want to try an Advantage plan. We use this often. maybe somebody's 68 years old, they've had nothing but a supplement, and they say, you know what, Ed, I really would like to try a zero premium plan, but I'm afraid if I try it and don't like it, I'm stuck in it. They aren't. They have a 1-year trial right. So you can have them rest assured that they can try an Advantage plan for 12 months. If at any time during that 12 months they don't like it, you can move them back to a supplement. It's a good way to get business. I mean, if you meet somebody who has a supplement you didn't write, talk to them about the trial right. Put them in the Advantage plan. If they like it, great. You're the broker. If they don't, use the trial right, switch them to a supplement, and you're still the broker of record on that case then. So it's important to know the trial right because it works in every state, and it can come in very useful for you, very handy. I mentioned at the beginning our lead program, so just keep that in mind. It's for leads, marketing, or advertising, any company you want. It's up to $500 reimbursement per agent per month. Do your enrollments online, especially with Corona. Use Connect for Medicare. It's free to you. It costs nothing. You need a username and password. You call us or Pinnacle to get it. And that's pure online enrollment. No face-to-face required. No wet signatures required. And you can enroll people in Advantage, Supplement, and Part D plans purely online by sending emails to your clients with a link for the plan they want to enroll in. You can specifically pick the plan you want them to enroll in, and that's all they can take. Or you can give them a comparison and let them choose. Up to you. But that's a great tool to use. And as of October of 2020, for the 2021 AEP, it's not only going to be able to email them, but it'll be able to text them. So people who don't access email, you can text them the link. Use our quote site to quote and compare all plans. Our quote site will quote and compare everything, and you have access to it for nothing, and it's good in all 50 states. You can compare and quote Advantage plans, supplements Part D. Also has final expense on there, term and UL, long-term care, really good annuity quote and comparison engine to compare MIGA rates. You can run income rider comparisons and see which company pays out the highest income rider. And that annuity quote site uses annuityratewatch.com. So definitely would recommend using that if you haven't. You can review all our recorded webinars in our go-to channel. I'm going to send you out a recording of this webinar. But our go-to stage channel is there. I know it's a long URL, but it's www.gotostage.com/channel/Crow webinars. You can see all our webinars on there. We have hundreds of them on various topics with Medicare and other product lines that you can go through. Let me see if I have any questions, see if somebody sent any questions into the webinar. Don't have any questions at this time. I'll give you a minute. If anybody has any questions, you can just send them into the webinar. I'd be happy to answer them. Otherwise, you can just always send me an email or call our office. We'd be happy to answer your questions for you. But again, this process makes it simple for your clients, makes it easy. The key is when doing this is dummy it down as much as you can for people, because keep in mind, 90% of the people, that's actually, they've done surveys on that, 9 out of 10 prospects don't know the difference between an Advantage and a supplement. So the simpler you can make it, the easier you can explain it to them and keep it straightforward in their mind, the better you'll do. And you can use this process face-to-face, or you can use it certainly on Zoom meetings and non-face-to-face meetings as well. I think we do have a question. Let's see. Question came in, how do we know what companies to get contracted with? That's a good question. You can call us, and depending on where you do business, we can tell you what's competitive and what's being sold for Advantage and supplements in those states. The other thing, too, is we can give you access to our quote site on a trial basis. It doesn't cost anything either way, but if you don't have any contracts with us, we can give you access to our quote site on a trial basis, and you can quote and compare plans and see what's competitive. But really, if you don't want to do that, you can just simply call us or email us, and we'll say, okay, for this state, here are the most competitive Advantage plans, and here are the best price supplements to use. Good question, by the way. All right, it looks like that's all we have for questions today. Appreciate you joining us. Again, if you have any questions, just simply give me a call or email our office. If you want to know more about our lead program, we'd be happy to send that to you as well. One more question actually came in. After we're paid, are we paid commission after? Okay, so the question came in about, it's a good one, commission questions about supplements and MAs. So basically the question said, are we paid commissions after 2021? So I'm assuming they're wondering if you write during AEP this coming year for 2021, how do commissions pay? Yes, during AEP for MA and PDPs, the companies can't pay you for 1/1 effectives. So 1/1/2021 effectives, they can't pay you until January. So any AEP business you write in October, November, December, you won't get commission on that until January. Supplements, however, do not have to follow those rules. So supplements will continue to pay commission like normal. So if you have a mix of Advantage versus supplements, you're going to be on hold on your Advantage commissions, but your supplement commissions are still going to pay. So there's no rule for supplements. The other thing, too, is if you're writing any T65s or people coming off group coverage for October, November, or December effectives, you'll get that commission right away as well. It's just the AEP stuff you write for 1/1 effectives. You won't get paid on that till January. Really good question, by the way. All right, that looks like all we have. I appreciate you joining me today. Certainly call us if you have any questions. Thanks, and hope everybody has a great day.